Welcome to Cancer Explained with Central Care Cancer Center. It's likely that someone you know has been diagnosed with a form of cancer. Learn more about specific cancers, their risks, signs, symptoms, and treatment options by listening to Cancer Explained.
Hello and welcome to Cancer Explained with Central Care Cancer Center. My name is Leanne Powers. I'm the Marketing Director for Central Care Cancer Center, and with me today is radiation oncologist Dr. Perez-Tamayo. At Central Care Cancer Center, we are dedicated to keeping expert cancer care close to home. We have state-of-the-art facilities throughout rural Kansas and in Missouri. Whether you need radiation or chemotherapy, perhaps a second opinion, access to clinical trials and novel treatments, financial counseling, or other supportive services for yourself or your family, Central Care Cancer Center is here for you. And something else we want to mention, Dr. Perez-Tamayo, I'll let you kind of chime in on here too, but is our bilingual capabilities at our clinic. You know, with cancer, something complicated and perhaps even sensitive, it needs to be explained to a patient. And sometimes that doesn't translate the same through an interpreter, or our patients may not even ask further questions, correct?
Absolutely. In fact, especially with topics like cancer of the prostate, cancer of the breast, cervical cancer, sometimes the interpreter is a young, daughter or son, and it's a little bit difficult sometimes to be completely apparent into what we ask because it becomes a little sticky and people don't want to perhaps be as open. So I think that the bilingual possibility in Spanish and in English is very important. It's already a complicated topic, and to be able to discuss it in your own language is so satisfactory. And actually, then you really can make decisions that are based on facts and the reality of what we have.
And so that's where our bilingual doctors and staff, they may help bridge that gap, to help make that patient feel more at ease. So that is something that we just want to mention as well. At any time during the program, you can email with your questions or comments. The email address is askdoctor@cccancer.com. Today, our discussion on Cancer Explained centers around prostate cancer. We encourage men to love their prostate. It's important.
Okay, well, first of all, the prostate is the most manly part of a man. In fact, women can have just about anything that a man may possess as an external genitalia, but a prostate is distinctly a man. When there is ambiguity about sexuality as a young child is born, the prostate or uterus will definitely tell you what you have, a man or a woman, because sometimes as one develops, this can be ambiguous. The prostate embryologically, this is very important because sometimes what happens is that if we consider the treatment of cancer of the prostate or other parts of a male anatomy, they don't really start where they end. For instance, the testicles start at the kidney level as you are a child in the utero. So what happens is something develops, let's say, by the kidney, and then it starts developing vessels and nerves as it goes down and descends into the scrotum. So when you are treating a cancer of, let's say, the testicles, you have to treat the entire trajectory of where they started. Embryologically, the prostate, seminal vesicles, and the vas deferens originate from two separate structures. And therefore, they can have different cancers, and we're just going to be talking about the prostate at this point, but it's a very interesting part of what I do when I see a man for cancer of the prostate. The first thing I do is I show them where the prostate is and what surrounding structures are going to affect their side effects, or what things they can have that are causing symptoms which need to be brought to the doctor's attention. The prostate is located in a very busy part of the body. If you can consider the prostate being like a little ball that you let it go in a Dixie cup, it's surrounded at the very tip of the Dixie cup, or the point like a cone, by structures that are very tightly put together. So anything that affects the prostate affects the surrounding structures. And so the prostate gland is key to the reproductive system. To be able to make the semen or the sperm fertile, it has to have the enzymes that the prostate has to be able to make it be able to fertilize an egg. So here we have the prostate, which may look like a donut, where the middle or the hole is where the bladder drains through the urethra. So you can imagine that if you have hypertrophy or growth of the prostate, as many men do after 40 years of age, you have some crowding in this outlet. So what happens is men tend to want to be near the bathrooms. In the airplane, you'll see men wanting to be the aisle seat. Why? Because they have to go to the bathroom more often. Then likewise, top of the prostate is the bladder that's just like a little hat. If you can imagine a little hat right on top, like a top hat on top of the prostate, and it shares a wall. And then on the back of the prostate, if you can consider it like a walnut, on the back is the rectum. So if your prostate gets enlarged, both the bladder and the rectum can get affected. You can have for instance, the rectum be impacted by the prostate in that it gets to clog your intestines and you have constipation, you can't have a good bowel movement. Likewise with the bladder, instead of having a little hat like a top hat, you have a bonnet where it kind of wraps around your prostate, and every time you urinate, you feel like you didn't evacuate all your urine quite as well, and then you have to go back and go again. Now, unfortunately, since it's a fact of life that the prostates get to be bigger as one grows older, the bladder, in its defense to take the urine out of the bladder, it starts to grow muscle. So you can imagine doing exercise against a resistance, or isometric exercises, and you begin to grow a thick muscular layer when the bladder really is just a balloon that inflates and deflates naturally. Now, have you ever seen those leather bags that hold wine? You can't really put a lot in there. It holds as much as it's going to hold, and it's not going to completely collapse upon itself and deliver the entire volume of liquid. In fact, there's always be a residual. So what men face as when they grow older is that they have this leather bag instead of a nice balloon that doesn't completely empty and also holds less than it used to. And then in addition, because the sphincter right there can get damaged, there's a little bit of leakage because the sphincter does not close completely. And that's without cancer. That just is the way it is. In addition, the male anatomy, as you study it, you see that the nerves that control the ability to have erections is right at the very apex or the very bottom of the prostate. So this vascular bundle with the nerve, if it gets damaged for various reasons, you will lose the ability to have a hydraulic effect of the cavernous structures in the penis. And then what happens is you cannot have a functional erection. You may have an erection, but it's not functional. So it's a very delicate place. You can imagine, again, the Dixie cup, the pointed, that type of cone. And so any little bit of crowding is going to affect so many things.
How common is prostate cancer? I mean, I always feel like I hear somebody that has battled it or has had treatment for prostate cancer. So it seems to be pretty common.
Well, in fact, we don't even know how common it is because many men that die of other reasons, let's say heart attacks, have cancer of the prostate, which never bothered them. I did a study when I was at the University of Illinois in Chicago where we dissected the prostate out of men that died in the streets for various reasons, and almost half of them had cancer of the prostate that really was not bothering them, and it was not necessarily metastatic. So it is reported that 1 out of 9 men will be diagnosed with prostate cancer if you don't have a family history of cancer of the prostate. Now, if you have a family history of cancer of the prostate, and sometimes even cancer of the breast in women is associated with cancer of the prostate, then the risk is higher. The reality is that it is the most common cancer in men other than skin cancer, and it doesn't necessarily kill you, but it will cause you trouble. So ignoring it doesn't necessarily give you the quality of life that you may desire. You read in a lot of literature, something else will kill you and not your prostate cancer. But the reality is that it will give you a lot of trouble where you're going to have complete maybe or partial incontinence of stool or urine. And then if it is cancer that is more aggressive, it will go into your bones. And every time you stand up or hold, you're going to have a fracture. So you do need to pay attention. You do want to see what is your best choice at the time that you're diagnosed.
Again, I'm with radiation oncologist and president of Central Care Cancer Center, Dr. Perez-Tamayo. We've been talking about prostate cancer. And doctor, I wanted to ask you about prostate cancer as far as, is it slow to grow and develop? I mean, is this something that wham, bam, hits you and you realize something's going on? Or I know that you talked about the studies, how people didn't even realize that they had it.
Well, it comes in 10 varieties, actually 5 varieties, but they're given 10 different grades, scores actually. First of all, most of the cancers of the prostate are what we call adenocarcinomas. Adeno means it is from a gland versus a sarcoma or a lymphoma that comes from a different part of the prostate, which you can have. But since the vast majority are adenocarcinomas or cancers of the gland, then we're going to talk about that. And what do I mean by gland? Well, gland is a structure that secretes something. Like, for instance, you have glands everywhere. You can have, like, for instance, the glands that secrete sweat. You can have the glands in your lung that secrete mucus. These secrete something, which is the prostatic fluids that actually are able to make the sperm become fertile. So what happens is that the normal cells in the prostate are all cells that are together in a ring formation. Imagine like a ring in your finger. And these cells are all nicely shaped. They don't have any irregularity. Then something happens, either the family history or just because they get older and they no longer divide in a normal way. You start seeing what we call dysplasia or no longer the normal shape. There is something that could be irritating the cells that are causing this interepithelial neoplasia, we call it, or this irregularity within the ducts of the prostate. And then it becomes so irritated, it becomes cancerous. So if you can imagine, these cells no longer are going to be the same shape. Now here is where Dr. Gleason, who was a pathologist, devised a way of giving the cancer cells a number which tells you how aggressive this cancer is. So what he did is he took the microscope, saw what the majority of the cancer was, we call it the major pattern, and then the minority of the cancer, and it gave them a grade, or how aggressive is it? Like, for instance, a tornado. How destructive is it? It's going to get a number. So a 1 is a cancer that is very close to this ring formation, like a normal cell would be, holding each other in a ring with very little variation. And then a 5 is a cancer that does not have a ring at all. It's a sheet of cells, all irregular, odd cells. And then the major pattern is given a grade of 1 to 5, and the minor pattern is given a grade of 1 to 5, and then you add it up for a score, a Gleason score. The Gleason score then will tell you 2 numbers. The first number is the major pattern, the majority of the cancer, and the second number is the minor pattern. Now, a urologist will come and biopsy at least 6 sections of your prostate. It can be more than that. So it can give you what percentage of this Gleason score is in each of the sections. Not all sections will have the same score. Some will be, well, some of them, they can be the same score, like a Gleason score of 3 plus 3 equals 6. But some of them may have 3 plus 3 equals 6 in the left side, and maybe 4 plus 3 on the right side. And it really is very important whether the biopsies are positive at the top near the bladder, we call it the base, or the bottom, which is the apex, where the vascular bundles are, where you have these nerves that control your sphincter and your erection. So what happens is when you have a cancer that is very much in the top, you have a higher risk of having invasion of your bladder versus the bottom, you have a very high risk of having destruction of your vessels, and therefore you may have problems with erections if your cancer's on the bottom and you have to have surgery to remove them. So here we have a way of grading your cancer. So when you come and see how aggressive is your cancer, it really depends on your Gleason score. So when you choose for treatment, it's not one of those smorgasbord where you say, give me less broccoli, I'll take more lettuce. It's really dependent on what your cancer is all about. And also how fast your PSA is elevating. Now your PSA, we haven't really talked about that. That's kind of a juice you see in your blood that is secreted by these cells. And it gives you kind of an idea of how fast or how aggressive the cancer is behaving, but not always. In fact, sometimes when the monster cells are very wild, like a Gleason score of 10, you may have a PSA that's very normal, in fact, less than normal, because these cells are so poorly differentiated or so poorly made that they cannot even make this juice anymore. They're now, in fact, you can have PSA of 0 and have cancer everywhere in your body. And you can have a PSA of 1,000 and not have any cancer. So you need to have both the blood test, prostatic specific antigen, the PSA, and a rectal exam to tell exactly what's going on.
That's the screening option that you should get. Is that a yearly screening, do you think, when it comes to a certain age for males?
I recommend, it depends on your family history, but at a minimum, after 50 years of age, you really need to have a rectal exam and PSA done in a yearly fashion.
The risk factors that are involved with prostate cancer, I know we've talked about a little bit about age and, of course, family history, because you run the risk, of course, if it runs in your family, of having it yourself, correct?
Yes, family history is very important. And, of course, prostate cancer can run in families where you have the father, the grandfather, the brothers. And most of the time, these are usually younger men that have this, and they're more aggressive Gleason scores. But there's also other things that have been suggested to be a possibility of having a more impact on producing cancer of the prostate, and that includes people that consume a lot of calcium, for instance, or other carcinogens in red meat. But the reality is none of these have really panned out to be, conclusive. There's no doubt that your age is your number one factor for risk. So as you grow into your 50s and 60s, your cells, which are being produced all the time, anytime you divide a cell when you're older, these cells are older. So the chance that they are going to reproduce in a bad way, in a mutated way, is much higher. So you can imagine, just like when you have children, they recommend having children when you're younger. Why? Because your chances of having congenital anomalies is higher as you grow older. And it's the same thing for your prostate. As you grow older, the congenital anomalies based on just the way that it reproduces is higher. Now, there is some ethnic tendencies that have been seen. In fact, this is very important. I want to stress it very, very much. And those are the African American men and the Caribbean men of African ancestry. It is very much higher. I mean, a lot higher. And also a lot more aggressive. We can treat this cancer and cure it. Why in the heck would you not want to come in? So there's an importance of having your prostate cancer checked if you're African American and Caribbean with African descent. Here again, much younger, I said 50 years of age to get your PSA checked. But if you have a family history or you are in one of these risk groups, please go sooner.
With the PSA, that's a blood test. I understand that. And then with the digital rectal exam, what is exactly the doctor feeling for? Inflammation of some sort, or?
Well, that's a very interesting question, because I feel that it is an art that unfortunately sometimes is not done enough. First of all, the rectal exam, both on men and women, give you a lot of information, not only of your rectum per se, but of the surrounding structures. In a man, when you're feeling the prostate, which is right there at the entrance of your rectum, it is within the reach of the examining finger. And what you're supposed to feel, if you can imagine a walnut on its axis, you feel the seam of the walnut between the two lobes. And if you don't feel that seam, it's because there has been growth of the two lobes to the point where you are no longer feeling the semen smooth, and we call that ablation or effacement. Then likewise on the sides, if you can't feel the outline of the walnut, you're feeling that it is flat. That means the cancer has gone outside the capsule into the surrounding structures, and it's no longer a distinct anatomical structure. And so this is important because if you have a Gleason score that is high and you also have abnormalities of this sort, it is important to get treated.
Again, I am Leanne Powers with Dr. Perez-Tamayo from Central Care Cancer Center. We've been talking about prostate cancer. And doctor, I just wanted to ask you, when it comes to symptoms for prostate cancer, anything that men should be on the lookout for as far as even urinating problems or...
Well, as I mentioned to you, Leanne, most men, no matter whether they have cancer in the family and prostate or not, will have some symptoms of hypertrophy. Hypertrophy means the growth of the gland without necessarily cancer. I would say 100% of men will have growth of their prostate as part of the aging process. So the frequency, urgency, and urination in the night is not uncommon. So sometimes that's the problem with cancer of the prostate. Because you have this doesn't mean that you have cancer of the prostate. In fact, it usually just means that you have a large prostate. And some men inherit a bigger prostate than others. Now, there are symptoms, unfortunately, that we see that are late in the game here with the prostate cancer, and that is if you have blood in the stool, blood in the urine, or what we call hemospermia. In other words, that when you have an ejaculate, that you have blood, or that you have a dry ejaculate, meaning that it's going inside you rather than outside. All of these are advanced cases, and you don't even want to go there. If this is a very, very curable disease, why would you want it to get out of hand? So unfortunately, most of these cancers are pretty silent. Not that you have to run and get something done. In some of these cancers, they may be quite slow growing and will not give you any trouble. And of course, if you're 90 years of age and you have a heart condition and you have a cancer that's very slow growing, it's not going to cause you trouble. Now, if you're 40 years old and you have a family history of cancer and your cancer is a Gleason score of 8, 9, then there's no doubt about it. You're going to have problems that are going to be very, very impactful in your quality of life. So these are the things that, if you want treatment or you don't want treatment, it is your choice.
Can prostate cancer spread, of course, to other organs, liver, bladder?
We don't know why cancer of the prostate preferentially likes to go into the bloodstream, into the bone. But it usually first starts in the prostate and it grows to the surrounding structures, which usually is the bladder rather than the rectum, because the rectum has a very thick fascia called the Novalier's fascia, and it doesn't dig as much. Now you can imagine cancer of the prostate being like bindweed. It can have roots. Then it can go into the lymph nodes. The lymph nodes are these channels, lymph node ducts and channels into the node that is our filters. So they can go into the lymph nodes. And then thirdly, it can go into the bloodstream and attack your bones. It can also go into the lung and the liver, even the brain, but it's not as common. Most men's cancer, if it's going to be metastatic or spread into the bloodstream, is going to be in the bone. So again, it is very impactful because if it goes into the bone, you're going to have pain. Sometimes you're going to have breakage because these cancers like to eat your bone up, basically. And even moving can cause you to have a fracture, and you don't have to go there. I really recommend that whatever you decide, if you want treatment or no treatment, you need to make up your mind based on evidence and not on, just not wanting to go to the doctor.
That is true. What would be the treatment options necessarily for prostate cancer?
Well, we have many these days. Some of them are as simple as observing and doing something we call hormone deprivation therapy. And what that is that we know this cancer loves androgens, or what males make their hormones to be a man. But removing the testicles or giving you a shot or a medication that gives you what we call chemical castration may not be enough, because you make androgens through other ways. And not all cancers of the prostate are manipulated by decreasing your hormone levels. Some of them will care less whether you take their hormones away or not. And just like I always say this, if you had a fever due to an infection and I gave you Tylenol, well, your fever would go down. And then you spiked again, and I'll give you more Tylenol. And there comes a point where no Tylenol is going to take the fever because you need to treat the infection with antibiotics. The same thing for cancer of the prostate. Taking away the hormones may decrease the rate of growth, may decrease your PSA, but that doesn't mean that you got the cancer beat. Now, because now we do very fine surgery, some men are eligible for a surgical removal through robotics or through we call it Da Vinci format, which is almost, I always say, a drive-through, because truly people just stay a day and they're ready to go. Now, sometimes it is complete removal of all the prostate cancer and there's no problems. Sometimes there are positive margins, or sometimes their PSA never really quite goes down after surgery. And then you still have an option to get adjuvant treatment, or treatment that will clean up any possible cell that could be remaining with the radiation. Second, you can have radiation only, which gives you the equal amount of benefit than surgery, but it does require coming in. It could be in a shorter period or longer period, depending on the volume and where this is. And there's other additive techniques which make it even safer for the surrounding structures, including something called a spacer, where we actually take a gel and take your rectum away from your prostate by inserting this gel in, so that you don't have to worry about rectal problems. Now, I was the first to publish in the world on cancer of the prostate treated with the doses that we treat today. And it's called intensity modulated radiation, and we are now doing image-guided radiation, and therefore I have a very long and actually first to publish in the world on this technique. So I have seen that most prostate cancers are treated very safely without much trouble by doing these special techniques that are able to bend the beam and treat the prostate or prostate and seminal vesicles, or even lymph nodes with being greatly exact and focused, and you can avoid treating your normal structures. Sometimes we do it with hormones in addition to the radiation, and sometimes we do it without. So there are really quite a few options. And in a curative way, they're excellent, very, very curative, if we have it in time. Here again.
Screening
and knowing your options and not knowing your stage.
Yeah, exactly. Is it possible for prostate cancer to reoccur?
Yes, it can reoccur. And many people ask me this question: what if I get prostate cancer and I treat it with radiation? Since you did not remove my prostate, would it could come back in the prostate? And the answer is possibly. Like with surgery, removal of the prostate doesn't mean you're guaranteed that the prostate cancer is going to recur locally. But the reality is that where the cancer likes to come back is not locally and regionally, although it can, but systemically, meaning in the bloodstream. And that doesn't mean that it got disseminated during the treatment. No, it means that it was there. We just couldn't recognize it. It takes about a half of a centimeter or 5 millimeters of cells together to be able to be seen in many of the radiographic examinations. Each 5 millimeters of cancer is 1 million cells. So you can imagine by the time you can see it, it is rather large. Now, if you put that into your calculator, put 1 million and then put it to the second power, that's how it grows. It grows exponentially. So again, it is not a mathematical growth like 2 plus 2 is 4. It's 2 to the second power, 4 to the second power, 16 to the second power, and now put 1 million to the second power, and then that number. So when it starts growing, it's growing quickly.
Does an enlarged prostate mean you are having trouble, with your sexual performance as well? Does it affect that?
Oh, yes. A large prostate can cause you much trouble, because anything around it, including the nerves there, can give you some problems with erections. And there are many, many now treatments for that. So you can actually, whether you have cancer or not, be treated for erectile dysfunction.
Anything else you want to add about prostate cancer and how men should love theirs?
Yes. Men should love their prostate, yes. However,
Take care of it.
Take care of your prostate. Don't ignore it. It will not ignore you.
Right, exactly.
So, and then again, there are some manipulations of your food which can improve the ability to have a controlled prostate and not let it get out of hand as to size, so that you don't have a bladder that is like a leather bag rather than a nice balloon. So, if I would have known this when I was 30, I would have started this nutritional change, which is very subtle. It doesn't require a lot, but it's basically eating healthy, especially blueberries and pumpkin seeds. But there's a lot of interest in the actual dietary changes that could make a difference in how your prostate becomes a problem or not as you grow older.
Thank you so much, Dr. Perez-Tamayo. Well, we appreciate you taking the time to listen to Cancer Explained with Central Care Cancer Center. With facilities throughout rural Kansas and in Missouri, Central Care Cancer Center offers complete cancer care, all under one roof, so there's no need to travel far for the best care. Whether you need radiation or chemotherapy, perhaps a second opinion, or access to clinical trials, financial counseling, or other supportive services for yourself or your family, Central Care Cancer Center is here for you. You have a choice. Bringing expert care to you is an important component in the success of your outcome. Being surrounded by your family and friends, that can be the factor that elevates your treatment. Feel free to reach out by calling 800-592-5110. Visit us online at cccancer.com. You can always send an email to askdoctor@cccancer.com. For Dr. Perez-Tamayo and all of our amazing providers and nurses, I'm Leanne Powers. Thank you for listening to Cancer Explained with Central Care Cancer Center.
You've been listening to Cancer Explained with Central Care Cancer Center, offering expert cancer care that's close to home. Central Care Cancer Center has clinics throughout Kansas and in Missouri. Central Care Cancer Center, online, cccancer.com.